Hi everyone, and today I'm going to talk about the purpose and theoretical model of Virginia Henderson's nursing need theory. So, as you all know, Virginia Henderson's nursing need theory is a foundational concept that laid the groundwork for other nursing approaches in the 20th century. So, now let's explore the purpose of this theory. So, as previously said, Virginia Henderson developed the nursing need theory, emphasizing on need. So that leads us to the first purpose of the theory is meet the needs of the patient. Henderson's theory emphasizes the basic human need and how nurses can meet those needs. Example, patients might need help getting healthy or recovering from injury or sickness, surgery. They also need help being independent. So for the nurse, they help the patients perform activities that they would do for themselves if they are able to. Next purpose is patient-centered care. Her definition underlined the importance of patient autonomy in health promotion, demonstrating the shift from traditional patient-nurse dependency to a more collaborative, patient-centered care delivery model. For instance, rather than just administering the medication to a patient, the nurse, according to Henderson's definition, would educate the patient on the roles of the medicine, the dosage, and possible side effects, thus promoting active participation in their healthcare. This example is from number 14 of her theory. Learn, discover, or satisfy the curiosity that leads to normal development and health and use the available health facilities. So there is always a purpose of what you are doing. The next purpose is help the patient become as independent as possible. This enables nurses to assess their nursing competency when it comes to preserving a person's degree of independence and health promotion. By assessing the patient's ability for independence or whether they have achieved the 14th needs, the nurse can know what further steps they should take towards care, what the nurse does to make the patient more independent. So, in order to help the patient become as independent as possible, Henderson describes the nurse's role as substitutive, which is doing for the patient, supplementary, helping the person, and complementary, working with the person. Okay, so now let's proceed to Henderson's theoretical model. So Henderson's 14 components can be used or compared to Abraham Maslow's hierarchy of need due to their similarities. So this is Henderson's model as applied to Maslow's hierarchy of needs. Now let's compare it to Abraham Maslow's as a short comparison. So Maslow's hierarchy of needs is one of the most commonly used non-nursing theory. So this is the general um, diagram of Maslow's hierarchy of needs. There's physiological at the bottom, safety, love and belonging, esteem, and self-actualization. So Maslow's hierarchy is split into 5 categories. To put simply, unless we have the fundamental basic human needs, which is safety and physiological, if we do not meet the thing if we do not meet the things at the bottom of the hierarchy, we will not strive to meet any further desires, such as psychological needs and the self-fulfillment needs, which is self-actualization. As each requirement is fulfilled, we move up the hierarchy. The hierarchy of needs is just like climbing a mountain, or in this case, a pyramid. You start from the bottom first so that you can go to the top. It's the same with Henderson. Unless the nurse can achieve these needs at the bottom, the nurse will not strive to meet any further steps in the hierarchy. For example, if a person has been admitted to a hospital following a surgery, the nurses are likely looking to fulfill the patient's physiological needs first. That is from number 1, breathing normally, such as assessing the respiratory rate or ensuring she's not experiencing respiratory complications. So these are just the general steps you should take towards care. It is applicable towards any illnesses, and you can do any type of um, medical procedures for the patient to be able to breathe normally. So now after you have checked number 1, you then proceed to number 2 until you go up to the hierarchy. So the nurse would probably not be concerned with the work here in number 12 of the patient, or let them participate in various forms of recreation here in number 13, if these at the bottom have not been achieved. Because if these have not been achieved, there may be possible complications to happen. So you focus on this first. Because how could you let the patient play games or go to work without making sure they are breathing normally? As nurses, always aim to have progress for the patient so that you can go to the top of the pyramid. Going back to the purpose of Henderson's theory, this diagram is meeting the needs of the patient. As you go to the top, there is progress in patient's independence, or there is more independence. And so the hospitalization would not be delayed or not needed anymore at the top. So how is Maslow's hierarchy of needs applied here? So same with Maslow's, the pyramid has 5 components. But in this case, the 14 components are only applied to the 4 components. Physiological needs covers 1 to 8, while safety needs cover component 9. And the love and belongingness category includes the 10th and the 11th component, whereas the self-esteem requirements category includes the 12th, 13th, and 14th component. So that is for Henderson's theoretical diagram as applied to Maslow's hierarchy of needs.